Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. And here in this video, we can see some important points for your exam as well as interviews. First points is from medical syndromes. Okay, first one we'll see carotid sinus syndrome. Carotid sinus syndrome is a syncope sometimes associated with convulsions due to overactivity of the carotid sinus reflex when pressure is applied to one or both carotid sinus. That is, it's a type of fainting. And also sometimes convulsion means fits, occurs due to pressure on the carotid sinus. That is carotid sinus syndrome. And the next point we can see carpal tunnel syndrome. It's a pain and burning or tingling paresthesia in the fingers and hands due to compression of the median nerve. Okay, carpal tunnel syndrome means burning sensation or tingling paresthesia. Paresthesia means numbness in the fingers and hands. It occurs due to the compression of median nerve. That is carpal tunnel syndrome. And next syndrome is central cord syndrome. Central cord syndrome is an injury to the central part of the cervical spinal cord resulting in disproportionately more weakness or paralysis in the upper limbs than in lower. Pathological changes is caused by hemorrhage or edema. The central cord syndrome occurs due to the injury of the cervical spinal cord. It occurs in the cervical region. So, cervical region is in the upper part. So, weakness or paralysis occurs in the upper limb than lower. That is central cord syndrome. And the next one, Charcot syndrome is a progressive degeneration of the neurons that gives rise to deficit of upper and lower motor neurons. It is one of the degenerative changes of the upper and lower motor neuron, that is Charcot syndrome. And the next point, Drash syndrome is an inherited syndrome of Will's tumor with glomerulopathy and male pseudohermaphroditism. Drash syndrome is one of the inherited disorder with glomerulopathy. Glomerulopathy means genetic disorder of the glomerulus, and also male pseudohermaphroditism means is an individual male person with the testes and genitalia resembles like female. That is known as male pseudohermaphroditism. So it's an inherited disorder with glomerulopathy and male pseudohermaphroditism. And next point, pulse oximetry values we can see. Normal oxygen pulse oximetry value is 95 to 99%, and in mild hypoxia it is 90 to 94%. Hypoxia means decreased oxygen content in the tissues. In that case, we can give oxygen to the patient, and moderate hypoxia means 86 to 90%. So we have to give oxygen administration, and severe hypoxia means it is less than or equal to 85%. Less than means patient need emergency management. Okay, and next important point we can see falsely low SpO2 values, that is pulse oximetry value reading may occur in case of cold extremities, hypothermia and hypovolemia. False low values, okay, and false high values we can expect in case of anemia and carbon monoxide poisoning. Falsely low values in cold extremities, hypothermia and hypovolemia, and false high values can expect in anemia and carbon monoxide poisoning. This is an important point. Next point we can see some hemodynamic values we can see. First point is systolic arterial pressure. Normal value is 90 to 140 mm of Hg, and diastolic arterial pressure it is 60 to 90 mm of Hg. Okay, normal systolic arterial pressure and diastolic arterial pressure. Next point is central venous pressure. It is 2 to 6 mm of Hg or 2.5 to 12 centimeter of water. Central venous pressure. And left arterial pressure is normal value is 8 to 12 mm of Hg. Left arterial pressure. And the very next point, pulmonary artery systolic pressure. It is normal 15 to 30 mm of Hg. Pulmonary artery systolic pressure. Okay. And pulmonary artery diastolic pressure is 5 to 20 mm of Hg. And the next point, pulmonary artery pressure. Normal pulmonary artery pressure is 10 to 30 mm of Hg. Pulmonary artery systolic pressure, it's different, that is 15 to 30, and diastolic pressure is different, that is 5 to 20. Here, pulmonary artery pressure is 10 to 30 and pulmonary artery wedge pressure is 5 to 15 mm of Hg. All are confusing, but you have to learn it. Okay, pulmonary artery wedge pressure. And next point, pulmonary artery end diastolic pressure is normal value 8 to 10 mm of Hg. And right atrial pressure is 4 to 6 mm of Hg. Next point is some routine different tests we can see. Heat and acetic acid test is used to detect proteinuria. Then Albustix test or albumin test is also used to detect proteinuria. Albustix test. Next is Multisticks test is used for detecting pH, acetone, glucose and specific gravity. And Benedict test, as we all know, for urine sugar. And diastix test also for urine sugar. Next is Arothra test for urine acetone. Multisticks test, Benedict test, diastix test and Arothra's test. The next Ketotic test for urine acetone, and Duke's method is for bleeding time. Then Ivy's method also for bleeding time. Duke's method and Ivy's method. And next is Wright's 2 method for coagulation time. And Lee and White method is also for coagulation time. And Wright's 2 method and Lee and White method are for coagulation time. And Dastrostick's method is for blood sugar. Okay, this are all today's important point section, and next points we can see in the next video.